Are you doing more harm than good with these medical tests after 70? It's one of the most uncomfortable truths in modern medicine. Not every test you're told to do is actually helping you. In fact, for people over 70, many routine screenings can cause more harm than benefit, leading to unnecessary treatments, stress, and a lower quality of life. What if much of what we consider preventive care is actually just a well-intentioned habit that no longer makes sense? Think about it. Just because technology can detect something doesn't mean it should. From bone scans to full blood panels, from heart tests to cancer screenings, there's a growing body of evidence showing that older adults are being overtested and overtreated. And the consequences: anxiety, side effects, surgeries that don't extend life, and sometimes even shorten it. This video is here to challenge the status quo. If you're 40 plus, have aging parents, or are thinking seriously about your own long-term health, this is the conversation you need to hear. We'll walk you through 8 critical tests and show you what the latest evidence really says about whether they are worth doing past a certain age. Stick around and follow the channel to learn how to protect your health, not just from disease, but from unnecessary medicine. When we talk about overdiagnosis in the elderly, we are referring to the detection of conditions that would never cause symptoms or affect the person's lifespan. These are diagnoses that sound alarming but, in reality, would have remained harmless if left undiscovered. Imagine identifying a slow-growing prostate cancer in a man over 75, one that would never have caused pain or complications. The diagnosis alone can lead to stress, unnecessary treatment, and a decline in quality of life. Overtreatment is the natural consequence of overdiagnosis. It involves medical interventions that do not improve outcomes and may, in fact, cause harm. In older adults, this could mean undergoing surgery, radiation, or taking medications with serious side effects, treatments that offer no real benefit in terms of life expectancy or well-being. Sometimes, doing less truly is doing more. Take, for instance, the PSA test for prostate cancer. It's a common screening tool, but in many elderly men, a positive result can lead to a cascade of interventions, biopsies, surgeries, hormone therapy. These steps might be unnecessary and can leave patients dealing with complications like incontinence or sexual dysfunction. All of this for a condition that might never have posed a real threat. This issue calls for a shift in perspective. Instead of chasing every possible diagnosis, healthcare should focus on what truly matters: improving the patient's life. A condition that poses no risk might be better left undisturbed, especially when the treatment could do more harm than good. The goal isn't just to add years to life, but life to years. Life expectancy should be at the center of every medical decision for older adults. But here's the catch: chronological age isn't the same as biological age. 2 people aged 75 can have completely different levels of health. One might be active and independent, while the other faces multiple health issues. Good medical care considers how a person is actually aging, not just the number on their ID. Tools like ePrognosis help clinicians estimate life expectancy using real-life factors, function, health conditions, and more. These tools provide a clearer picture of how long someone is likely to live with reasonable health. That information is crucial when deciding whether to start or stop certain tests or treatments. It's not about giving up, it's about choosing wisely. One key idea in this conversation is the 10-year rule for preventive screenings. That means screenings like colonoscopies or mammograms only make sense if a person is likely to live at least another decade. Why? Because the benefits of these tests usually take years to show up. Doing them when life expectancy is short often adds risk without reward. This shift can feel uncomfortable, but it's deeply respectful. It means treating people as individuals, not statistics. When doctors align care with a person's life expectancy, they are not cutting corners, they are honoring time, energy, and quality of life. That's not less care, it's better care. After age 70, cancer screenings often raise more questions than answers. Take mammograms, for example. While they can detect breast cancer early, in older women they are more likely to lead to false positives, alarming results that turn out to be nothing. These false alarms can trigger unnecessary biopsies, anxiety, and follow-up tests, all of which may do more harm than good. There's also the issue of overdiagnosis. Some cancers found through screening would never cause symptoms or shorten life. Yet, once discovered, they often lead to treatment. For older adults, treatments like surgery, radiation, or chemotherapy may reduce quality of life without offering real benefit. The key question becomes, is this test going to help or just complicate things? Colonoscopy is another example. Preparing for the procedure is demanding, and it involves fasting, laxatives, and sedation, all of which can be risky in older adults. Complications such as bleeding or perforation of the colon are rare but more likely as people age. And if life expectancy is limited, the procedure might never offer a true benefit. PSA testing for prostate cancer brings its own challenges. A single elevated number can lead to a cascade of further tests and treatments. For many men over 70, the prostate cancers found this way grow so slowly they would never become a threat. But the treatments can affect continence, intimacy, and overall well-being, costs that must be carefully weighed. When it comes to bone health in older adults, the conversation is changing. Traditionally, the DEXA scan has been the go-to tool for assessing bone density. But after age 80, its usefulness becomes less clear. What matters more is the actual risk of fractures, not just what the scan shows. Tools like FIAX can estimate fracture risk based on a person's overall health and lifestyle, without needing a scan. Prescribing bisphosphonates to treat low bone density is common, but in very elderly patients, the benefits often shrink while the risks grow. These medications can cause side effects like gastrointestinal issues or even rare bone complications. In patients with limited life expectancy, the real question is, will this drug prevent a meaningful fracture during their lifetime? Another important factor is frailty. A person's balance, strength, and fall risk matter more than a bone scan score. An 85-year-old who's active and steady on their feet might be at lower fracture risk than a 70-year-old with poor mobility. Strength training, home safety, and proper footwear can sometimes do more for bones than any pill. In many cases, repeated DEXA scans do not change the treatment plan. Instead of fixating on numbers, it makes more sense to focus on practical prevention, reducing falls, maintaining muscle, and supporting overall function. That's how bone health truly supports aging with strength and dignity. Routine EKGs in asymptomatic older adults might seem reassuring, but the evidence tells a different story. For people without symptoms, these tests rarely uncover anything that changes the course of care. What they often do is pick up small irregularities, like mild rhythm changes that aren't dangerous but lead to a series of further tests, stress, and sometimes unnecessary treatment. Stress tests are another area where more is not always better. Many older adults are referred for these tests simply due to age, not because of specific symptoms. But incidental findings can lead to cardiac catheterizations or stents that don't actually reduce the risk of heart attack in asymptomatic individuals. The result: a lot of anxiety and procedures with little to no real benefit. The heart rhythm is a major concern for aging adults, but not every irregular beat is a problem. Palpitations, dizziness, or fainting are valid reasons to investigate. However, when there are no symptoms, routine monitoring often leads to what experts call diagnostic cascades, one test leading to another, all without improving outcomes. What's needed is a more selective approach to heart testing. When a person is healthy, active, and not experiencing symptoms, testing should be guided by meaningful risk, not habit. The focus should be on lifestyle, blood pressure, and cholesterol control, which have far more impact on heart health than a random EKG. Comprehensive blood panels are common in routine checkups, especially for older adults. They often include tests like CMP, TSH, vitamin D, and cholesterol. While these tests may seem harmless, they can lead to unnecessary worry when results fall slightly outside the normal range, especially since those ranges are usually based on younger populations. For older adults, a borderline lab result doesn't always indicate disease. A slightly low sodium or mildly elevated glucose might simply reflect normal aging or temporary changes, not a chronic condition. Yet, even minor deviations can lead to follow-up tests, medications, and referrals, all of which may create more harm than clarity. The concept of normal ranges itself can be misleading. What's normal for an 85-year-old may not match the same lab values as a 35-year-old. For example, slightly lower kidney function or altered thyroid levels might not require treatment at all in a healthy older person. Acting on these findings without context can lead to overtreatment. A better approach is to ask, does this test result affect quality of life or functional ability? If not, it may be wiser to monitor rather than intervene. Medicine for older adults should aim to preserve well-being, not chase numbers. Thoughtful restraint often reflects deeper understanding and respect for aging. Screening for abdominal aortic aneurysm, AAA, has a specific purpose: to detect dangerous enlargements of the aorta before they rupture. For certain groups, like men aged 65 to 75 who have smoked, this one-time ultrasound can be life-saving. But after age 75, the benefits of this screening become far less clear, especially in people without risk factors. Why? Because the chance of finding an aneurysm that will rupture during a person's remaining lifetime decreases significantly with age and declining life expectancy. Most small aneurysms never grow large enough to require surgery. Yet once an aneurysm is discovered, it often leads to lifelong monitoring, anxiety, and difficult decisions about when, or whether, to intervene. Surgical repair of AAA is not a minor procedure. It carries risks such as infection, bleeding, and even death, especially in older patients with other health problems. For someone in their late 70s or 80s, the risk of dying from surgery might outweigh the risk of dying from the aneurysm itself. In many cases, screening past a certain age adds burden without offering benefit. Instead, health discussions should focus on overall cardiovascular health, blood pressure control, smoking cessation, and physical activity. These strategies help prevent aneurysms in the first place, while honoring the balance between safety and quality of life. As people age, the most effective medical care becomes increasingly personalized. Instead of relying solely on population-based guidelines, clinicians must consider the individual's unique health status, values, and life goals. What works for a healthy 65-year-old might not apply to an 85-year-old with multiple conditions. Moving from routine to relevance means asking, does this test or treatment help you, not just people like you? Shared decision-making plays a key role in this approach. It involves a real conversation between doctor and patient, weighing the benefits and harms of each option. Should this test be done now? Is it likely to improve quality of life or simply extend treatment time without clear benefit? This style of care respects the patient as a partner, not just a passive recipient. Decision aids can help make this process easier. These are tools, charts, visuals, or questionnaires that clarify options and risks. But more importantly, they help patients align decisions with their priorities, maintaining independence, avoiding hospitalizations, or staying mentally sharp. For some, avoiding unnecessary interventions is more valuable than detecting every possible illness. Ultimately, the goal is not to do less care, but to do the right care. Personalized elderly care is about relevance, not routine. It shifts the focus from what can we do to what should we do, honoring both science and the person behind the patient. This is how aging with dignity becomes a reality, not just a slogan. Join our members club to stay ahead with exclusive content and deeper insights into healthy aging. You'll get early access to videos, behind-the-scenes content, and direct conversations about the medical decisions that truly matter after 70. Now ask yourself, when was the last time you questioned a test your doctor ordered? Not out of distrust, but out of wisdom. Because being proactive about your health doesn't always mean doing more. Sometimes, the smartest move is knowing when to say no. Aging well isn't about chasing every diagnosis. It's about choosing care that respects your time, your energy, and your dignity. If this video gave you a new perspective, don't keep it to yourself. Share it with someone who might be facing these same questions. And if you want more content that puts truth above tradition, evidence above habit, hit subscribe, activate the notifications, and stay with us. Less confusion, more clarity. That's how we age with confidence.